It was a huge hit. I mean, it was a dramatic impact, I think, on everyone. I think most people that go to Orlando know that bar, know that place.
Really?
And I think that it's someplace that is not unknown, and it's difficult to find members that have been in the community for a number of years that didn't have a friend of a friend or a friend of a friend of a friend that was there or had been there or knew someone that was there or that was involved in some way. And so I think the psychological impact was absolutely dramatic. What my patients want is my patients want to be able to live their lives the way they're living their lives, being able to be healthy, be able to have long lives, and be able to go out with a drink with a friend and be able to do that and live like everyone else without having to live in fear of any kinds of danger coming to them or those that they love. We talked about it a lot. It was something that I think the patients really, it weighed on their minds quite a bit, and I think it's something that we need to look at. The health system that I work in, Northwell Health, actually at the Children's Hospital, was able, Cone's Children's Medical Center, was able to even have a small table that they set up in the cafeteria where they were able to raise money and reach out for individuals that wanted to have a part of what was going on in Orlando. They donated it to one of the organizations that was collecting in that area, and they were able to they didn't raise a lot of money, they just did it for one day, but it was a very spontaneous effort that really came out of the healthcare community that said, you know, we're in New York, we're not in Orlando, but we need to do something to be able to help. And I think that's a very dramatic and powerful case to be making, to really make sure that we're thinking about our friends and our colleagues and other individuals in this country. I think they do. I think patients that are LGBT feel more comfortable in the healthcare settings than they did a few decades ago. I think we've got a long way to go. I think there's a lot of variability from provider to provider, and we need to make sure that we're really providing a universally outstanding healthcare experience for everyone. And that's something that Northwell Health is really committed to doing, and that's something that I'm proud to be part of through our Office of Diversity and Health Inclusion, by really helping to create populations that can really be more knowledgeable about LGBT health, and making sure that we can reach out to every individual that's coming into our doors and be able to provide outstanding health care to them. I think some people are more comfortable than other individuals, and I think that the key is we need to realize that everyone needs to provide a level of cultural competency and healthcare equity to those individuals. Some providers and some individuals may feel more able to provide additional healthcare needs that are regarding certain minority populations, and I think that that's okay. I think we don't need to have everyone being able to do exactly the same thing. I think some people are going to be more comfortable than others, and I think what we need to do is we need to make sure that everyone gets a level of health equity, that people be called by the name that they want to be called, by the gender and the pronouns that they want to be called when they're at the doctor's office in the waiting room, and be able to that to happen to everyone. And then the kind of health care that occurs between a doctor and a patient needs to be individualized. Just like people have preferences on their primary care doctor or their oncologist or whatever, some people prefer a male doctor, a female doctor, an older doctor, a younger doctor, someone who's their race or ethnicity. I think regarding some of these populations, that's something that's true too. And so we need to make sure we're providing a certain level of health equity to everyone, and then we can provide expertise for individuals that really want to provide outstanding health care that's targeting one-on-one the individual health care needs of the minority health populations. I think we are. I think we're a very large health system, and I think we're really reaching out, and I think the fact that we have 12 of our hospitals that are on the healthcare equity index already is a phenomenal testament to the work that's being done. I think that there's a lot of other hospitals that are doing a very, very good job as well, but I'm pleased that we're kind of, as a health system, really on the edge of this, and are really trying to make sure that we're making our health, our hospitals and our outpatient practices is helpful and welcoming as we can to the LGBT population. The Healthcare Equity Index is actually an organization that has certain standards that it puts out, and I'm going to let them speak for themselves, but they have 4 core standards that they put out in 2016, and they have new core standards for 2017, and it's a ability for a hospital, a healthcare practice, or a private office to be able to be certified that it has certain responsibilities to the LGBT population, and that it's providing a certain amount of health equity regarding human resources processes, regarding transparency of healthcare, regarding healthcare needs, and making sure that the needs of LGBT individuals are met.